Well, sometimes it's the elephant in the room. We don't want to talk about it, but breast cancer is important. And there's a lot of things that people don't know. With me today is Johanna Wilson, Dr. Johanna Wilson, with her care at Amarillo Diagnostic Clinic. Welcome.
Thank you.
And you have some really good information I feel like a lot of people may not know about.
Right, so the breast density has recently been ruled by law to be included on mammogram reports.
Okay.
And it's important to know what a woman's breast density is, because that will alter the frequency of mammograms that she needs to have in the future.
Okay.
Now, mammogram density is based on the amount of ductules and lobules and then the supportive tissue in the breast. And the important thing is that the density is very difficult to distinguish between cancer and normal tissue. So a woman who has very dense breasts, the sensitivity of each mammogram is lower than if she has primarily fatty breasts.
Okay. All right. So what are the intervals? How often should you have a mammogram?
This is a subject of much debate and a lot of research that's been done, but what we believe to be the best interval now is that women aged 40 to 49 should probably consider annual mammograms, especially if she has dense breasts. Women aged 50 to 74 can probably reasonably go every 2 years. Some women may be able to go every 3 years if they have primarily fatty breasts. But the rule of thumb is at least every 2 years, and then self-exams included on a monthly basis or so.
Okay, so maybe studies are showing that information needed to change, right?
Right, so there's a risk of over-detection or false positives. And so the more frequently a woman gets a mammogram, the more likely it is that something benign is going to be found. Then we work it up, and there's a lot of anxiety and unnecessary procedures that are done as a result of that finding that ends up being nothing.
Right. So best advice would be check with your doctor, your own doctor,
Absolutely.
And see what they say.
Mammograms save lives, and we want to do them at the appropriate intervals.
All right. Thank you, Dr. Johanna Wilson.
Thank
we
you.
appreciate you being with us. Good information. And if you need more, you can head to newschannel10.com.